Imagine this: you're sitting quietly, maybe after a meal, and suddenly your chest feels tight. A sharp pain shoots through your left arm, your jaw feels strange, or your chest just feels heavy. Your mind races. Is this just gas? Or is my heart in danger? Most people panic, and some even ignore it, and that mistake can cost a life. Today, I'm going to teach you how to tell the difference between gas and a heart attack, how to read your body's warning signs, and the exact steps you can take to protect yourself. By the end of this video, you'll never be confused about chest pain again. Not all chest pain means you're having a heart attack, and understanding this difference can make a huge difference in how you respond in the moment. Many people panic the instant they feel discomfort in their chest because our minds immediately jump to the worst case scenario. But chest pain can be caused by many different things, and one of the most common causes is something as simple as gas. Yes, trapped gas in your digestive system can create pressure that radiates upward, pressing against the diaphragm and causing a sensation that feels remarkably similar to heart-related pain. You might feel a sharp twinge or a dull ache in the center of your chest, and sometimes it can even spread toward your shoulders or back, which is why it can be so confusing. The key difference lies in the context and accompanying symptoms. Gas-related pain usually comes with digestive signals that are easy to notice if you pay attention. You might feel bloated, gurgly, or unusually full, and sometimes burping or passing gas can relieve the discomfort. The pain might shift a little as the gas moves, and it often improves with a change in posture or after walking around a bit. These are subtle hints from your body that the issue isn't your heart, but your digestive system is reacting to something you ate or drank. On the other hand, heart-related pain or angina is often more intense and persistent. It usually presents as a pressure, heaviness, or squeezing sensation that doesn't get better with movement or burping. The pain can radiate to areas like your left arm, jaw, neck, or back, and it may be accompanied by other warning signs like shortness of breath, nausea, or excessive sweating. One of the biggest challenges is that heart pain can sometimes mimic digestive discomfort, especially in the early stages, which is why paying attention to risk factors and patterns is so important. Age, high blood pressure, high cholesterol, diabetes, smoking, obesity, and family history can all increase the likelihood that chest pain is heart-related. And even if you think it's gas, you should never ignore the possibility that it could be your heart. Many people also assume that heart attacks are always sudden and dramatic, but the truth is that many heart problems start slowly, with mild pressure or discomfort that can easily be mistaken for something minor like gas or heartburn. Being able to recognize the subtle differences between gas-related pain and heart-related pain can help you respond appropriately, but it requires awareness and careful observation, noticing whether the pain appears after a meal, improves with digestion-related movements, or is accompanied by bloating can point toward gas, while persistent pressure, spreading pain, or associated symptoms like dizziness or nausea should immediately raise a red flag. The key is that you don't have to be a doctor to recognize the difference. But you do need to listen to your body, consider your personal risk factors, and err on the side of caution when there's any doubt. Because chest pain should always be treated seriously, even if it turns out to be something minor. Timing and triggers play a huge role in helping you figure out whether chest pain is just gas or something more serious, like a heart problem. And paying attention to these details can make all the difference. One of the first things to notice is when the pain appears. Gas-related chest discomfort often comes on after eating, especially if you've had a heavy meal, fried foods, beans, or carbonated drinks. It can feel sudden or gradual, but the important thing is that it usually correlates with something you recently ate or drank. You might notice a bloated feeling, gurgling in your stomach, or a sense of fullness that spreads up into the chest. The pain can move around a little as gas shifts in your digestive system, and it tends to improve with simple actions like burping, passing gas, or even standing up and stretching. That timing coming on after a meal or in relation to digestion is one of the biggest clues that what you're feeling is probably not your heart. Heart-related pain, however, often behaves very differently. It may come on suddenly during physical exertion, emotional stress, or even at rest. And it doesn't have the same clear connection to eating or digestion. The discomfort often feels persistent, heavy, or like a pressure that won't go away. And unlike gas, it doesn't improve with movement, burping, or stretching. It may also radiate to your left arm, jaw, back, or neck, which is another signal that it could be heart-related. Understanding the timing and triggers also means paying attention to how long the pain lasts. Gas pain often comes and goes, sometimes only lasting a few minutes, or fluctuating as the gas moves around. Heart pain, on the other hand, can last longer than a few minutes and tends to intensify rather than ease off. You might notice that it escalates with activity or stress and doesn't respond to simple home remedies. Another factor to consider is repetition or pattern. If you consistently feel chest discomfort after certain foods or in similar situations, that's more likely to be gas, especially if it improves with digestion related movements. But if the episodes are unpredictable, sudden, or triggered by exertion or emotional stress, that's a warning sign that you should take seriously. Risk factors also play into timing and triggers. Older age, high blood pressure, high cholesterol, diabetes, smoking, obesity, and a family history of heart problems all increase the likelihood that chest pain could be heart related. Even if the pain seems mild or similar to gas, these factors mean you should treat it with caution. It's also important to note that heart attacks don't always follow a predictable pattern, and they can sometimes mimic gas or indigestion, which is why careful observation of timing, triggers, and accompanying symptoms is so critical. The combination of when the pain occurs, what seems to trigger it, how long it lasts, and what other symptoms are present can provide important clues. But it's never a substitute for professional medical evaluation. Even if the timing suggests gas, if there's any doubt, or if the pain comes with sweating, nausea, shortness of breath, or radiates to other areas, seeking medical help immediately is the safest choice, because chest pain is too serious to ignore, and understanding these patterns can help you act quickly and confidently. Watching for warning signs is one of the most important things you can do when it comes to chest pain, because not all pain is the same. And recognizing the differences can literally save your life. There are certain symptoms that act as red flags, and if you notice them, it's critical to take immediate action rather than trying to ignore or brush them off. One of the first things to pay attention to is the intensity and quality of the pain. Heart-related pain often feels like pressure, squeezing, or a heavy weight sitting in the center of your chest, and it can be persistent rather than fleeting. Unlike gas, which usually shifts or improves with burping or changes in position, heart pain tends to stay in one area or spread outward, often radiating to your left arm, shoulder, jaw, neck, or even your back. That radiating pain is a major warning sign and one you shouldn't ignore. Another key symptom to watch for is shortness of breath. If you feel like you can't catch your breath, even when sitting still or resting, it could indicate your heart is struggling to pump effectively. This is different from the light breathlessness that sometimes accompanies heavy meals or bloating. Coupled with chest pressure, shortness of breath is a serious signal that requires urgent attention. Sweating and nausea are other critical indicators. Sudden cold sweats or feeling nauseous without a clear reason, especially alongside chest discomfort, are often associated with heart problems. People sometimes mistake these symptoms for anxiety, indigestion, or even a reaction to heat. But when combined with persistent chest pain, they are warning signs you can't ignore. Dizziness, lightheadedness, or feeling faint is yet another red flag. These symptoms suggest that your heart may not be supplying enough blood to your brain and organs, which can happen during a heart attack. Unlike simple fatigue or mild discomfort from gas, this type of dizziness is abrupt and can feel alarming, and it always demands immediate medical evaluation. It's also important to note that the presence of multiple warning signs at once increases the likelihood that something serious is happening. For example, chest pressure accompanied by radiating pain, sweating, nausea, and shortness of breath is far more concerning than isolated mild chest discomfort that improves after passing gas. While it's natural to hope the pain is harmless, the safest approach is always to err on the side of caution. These warning signs are your body's way of telling you that something requires urgent attention, and acting quickly can prevent complications or even save your life. Another aspect to consider is that heart attacks don't always come with the classic crushing chest pain that movies often portray. Sometimes the symptoms are subtle and people may only notice mild discomfort, tightness, or pressure that worsens gradually. That's why paying attention to warning signs in combination, rather than relying on just one symptom, is so crucial. Recognizing these signals early allows you to call emergency services promptly, get medical evaluation, and receive treatment as quickly as possible. Chest pain accompanied by any of these red flags is never something to dismiss, and understanding what to look for can help you respond effectively and stay safe while reducing unnecessary anxiety about less serious causes. Self-checks at home can be helpful in giving you some initial clues about what might be causing your chest discomfort. But it's very important to remember that they are not a substitute for professional medical evaluation. There are some simple actions you take to see if the pain responds in ways that suggest gas or indigestion. But even if these techniques seem to provide relief, you should never assume the problem is harmless without consulting a healthcare professional. For example, gentle movement or changing your position can sometimes ease gas-related pain. Sitting upright, standing up, walking around, or doing some light stretching may help release trapped gas or ease bloating. And if the pain improves noticeably with these actions, it could point toward digestive discomfort rather than heart issues. Deep breathing exercises can also be useful. Taking slow, controlled breaths may help relax the diaphragm and relieve pressure from gas, which can temporarily reduce chest discomfort. Even sipping water or trying to burp can sometimes provide relief if gas is the culprit. Paying attention to patterns is another form of self-check that can offer clues. If you notice that chest discomfort consistently occurs after certain meals or foods, or improves when you engage in simple digestion-related movements, that is more suggestive of gas-related pain. However, it's crucial to emphasize that these self-checks are only initial indicators and cannot confirm that the heart is completely safe. There is no home test that can definitively rule out a heart attack or other serious cardiac issues. If the pain is persistent, heavy, radiates to the arm, jaw, neck, or back, or is accompanied by shortness of breath, nausea, sweating, or dizziness, these are warning signs that require immediate medical attention. Waiting or relying solely on home checks in such situations can be extremely dangerous. Self-checks should be used only as a first step to assess whether the discomfort is likely minor, but they should always be followed by professional evaluation. When there is any uncertainty, even people who appear young, fit, or healthy can experience heart-related chest pain, and relying too heavily on at-home techniques could delay life-saving care. Another point to consider is that self-checks can sometimes provide a false sense of security. Gas pain may improve temporarily, but if underlying heart issues exist, symptoms can return suddenly and escalate quickly. This is why caution and prompt medical evaluation are always recommended. Being proactive in recognizing patterns, trying simple relief techniques, and monitoring associated symptoms can give you valuable insight into what might be happening, but they are not definitive. The goal is to give you initial guidance without creating false confidence. Listening to your body, noting what triggers the discomfort, and observing how it responds to movement or digestion-related actions are useful steps. But if there is any doubt, the safest course of action is to seek immediate medical attention. Treating chest pain seriously, even when it seems minor, can prevent serious consequences and ensure that you receive the right care at the right time. Prevention and awareness are some of the most powerful tools you have when it comes to protecting yourself from both gas-related chest discomfort and heart-related problems. And focusing on these aspects can save you a lot of stress and even potentially save your life. One of the first things to consider is your daily habits, starting with your diet. Eating smaller, balanced meals and avoiding foods that are known to cause bloating or gas, such as highly processed foods, carbonated drinks, beans, or very fatty meals, can make a huge difference in reducing digestive related chest discomfort. Chewing food slowly and mindfully also helps your body digest more efficiently, reducing the chance of trapped gas and the uncomfortable pressure it can create in your chest. Staying hydrated is equally important because water helps your digestive system function smoothly and prevents unnecessary bloating. Physical activity is another critical factor in prevention. Regular movement, even simple activities like walking after meals, helps move gas through the digestive tract, eases bloating, and improves overall cardiovascular health. Exercise also strengthens the heart, improves circulation, lowers blood pressure, and reduces stress, all of which decrease the likelihood of heart-related chest pain. Managing stress effectively is another piece of the puzzle. Stress can both trigger digestive issues and place extra strain on the heart. So, incorporating relaxation techniques like deep breathing, meditation, yoga, or even short breaks throughout the day can help your body maintain balance. Knowing your personal risk factors is also key to prevention. Age, family history, high blood pressure, high cholesterol, diabetes, smoking, obesity, and a sedentary lifestyle all increase your risk for heart disease. And being aware of these factors allows you to take proactive steps to reduce them through lifestyle changes, regular check-ups, and medical guidance. Keeping track of recurring chest discomfort is another form of awareness that can be very helpful by noting when the pain occurs, what activities or foods seem to trigger it, and how it responds to movement or digestion-related actions. You create a record that can be invaluable for a healthcare professional. This level of self-awareness allows you to distinguish patterns that suggest gas versus heart-related issues. And it also gives your doctor more information to make an accurate assessment. Even with prevention and careful monitoring, it's important to remain cautious. Chest pain should always be treated seriously because even with healthy habits, heart problems can still occur. Awareness doesn't replace professional evaluation, but it equips you to respond quickly, recognize early warning signs, and reduce unnecessary anxiety. Essentially, prevention and awareness work together to empower you. By adopting healthy eating habits, staying active, managing stress, understanding your personal risk factors, and tracking patterns of discomfort, you put yourself in a position to reduce both minor digestive issues and serious cardiac risks. Listening to your body, respecting its signals, and taking proactive steps before problems arise is the best strategy for long-term health. And it ensures that when discomfort does occur, you have the knowledge and preparation to respond safely and confidently.